Hello, you connected with Physical Health by Dr. Potter, and in today's video we're going to be doing a series of exercises to help you with relaxing and stretching the back and the hips. Back and hips are extremely important to maintain good flexibility because the majority of the time when the muscles are very tight, there is a lot of compression in the joints, and that compression can accelerate the process of arthritis and irritates the surfaces of the bones as well as the soft tissue around, if it's in the case of the spine, the nerve roots of the lumbar and sacral plexus, creating pain towards the flank, towards the groin, the side of the legs, as well as the sciatica pain. So these exercises will help you to start doing some of the gentle exercises that I usually start with my patients, and I recommend you to take the shoes off. It will give you more freedom for you to move, okay? So when the muscles are more relaxed, there's more space in the joints, and then your body will have less irritation into the area and the inflammation will calm down. If you're very stiff and it's very difficult to start the exercise, I recommend you take a nice good shower, perhaps even some hot bath, if there's no medical contraindication for you to do that. And also use Epsom salt, because Epsom salt is rich in magnesium, and magnesium is a natural muscle relaxant. So that can help you to relax your muscles before doing a series of stretches, okay? Remember, if you're having any issues, any joint pain, I will try to provide a series of modifications of positions using props, and that way it will allow you to feel more comfortable. But to begin, this is it. You started with the crisscross applesauce, and I want the foot to be unstacked. Usually people like to cross with the ankles right under the shins, but that will kind of compress a little bit, and I want the hips to open as much as possible. If your hips are hurting too much because you have a lot of flexibility issues and you're here and you're like sitting, most of the people when they're very tight, they're like this. They cannot sit tall and the hips cannot come flat. So I recommend it. Use your props. All right. Started with either pillows or a foam pad. I love my foam pads. They are into my store and my website. When using a little bit of the pad, it will give you a little extra support to elevate your hips. And that elevation of the hips, whether it's something low like this, it will allow you just to relax your back a little bit more in your hips. And the props use on the side of the knees, so your knee doesn't feel like you're guarding and having to hold your knees up because it has too much restriction into the hip. Little by little, your restrictions will decrease. That's the most important thing. We're looking for the flexibility to take place and the joints to not hurt. But when you're having a lot of limitation, you may find that it does not feel comfortable to begin with, and then don't be scared to do it, because when you first get into those positions, your body's not used to do that, and so don't fight it. Try to find a way to relax. So if you're starting here and you're sitting on the back of your butt, you can see in the image all the way in the back how my back is curved and I'm hunched. Can you see that? Right? If you like this, you're gonna try to start by tilting your pelvis and kind of loosening it up a little bit. So use your props to allow you just to start moving. This is cat and cow in yoga, and sitting in the crisscross is an alternative position than doing in the hands and knees. Okay? So start moving and feeling like you are just relaxing. Breathing. Let the air come in and out. Do little circles. My famous pelvic dance. And doing both directions. Feeling the restrictions. Feeling where you feel tight. If this is where you want to start, and just be used to be there for about 10-15 minutes, be there, but be in good posture. Relax into your shoulders and use your props. I'm gonna remove, because for me, I don't need them, but you might be different for you, alrighty? So I'm gonna remove all my props because I don't need them. I stretch regularly, so I have no restrictions, as you will see. And the positions that I am suggesting here, they are there, just a suggestion. You're the one who feels the stretch, so don't hesitate to skip it or try to modify. If it doesn't feel good, take 2 or 3 breaths and see if that makes a difference and you're able to say, okay, it doesn't feel so bad. Move the props around, a little bit more in, a little bit more out, or just put the leg a little bit more like that. Modify, okay? And of course, subscribe so you can see the variety of exercises that I'll be posting in the videos, and put in a comment so I can actually give you specific suggestions. I'm open to making up videos based on what people need, and as they are looking to my channel and finding out that, oh, this is not working for me, how do I make it work? Let me know, reach out to me and I will help you out with that, okay? Alrighty, so after a while you're sitting here and you're feeling more comfortable, we're gonna start with a gentle twist. One hand is gonna go behind you and it's gonna be nice and tall. You don't wanna be sitting in the back of your butt, right? Fingertips, left hand is gonna go across your right knee and you're gonna twist from your belly button. It doesn't matter how much you twist, as long as you feel some sort of pulling. And you're gonna stay there. Take a deep breath in. And breathe out. Breathe in again. Breathe out and move your head to your right shoulder. Keep the breathing in and out. Let the neck follow the twist. And breathe out. And the next breathing in is breathe out, turn the neck to the opposite direction. So you feel a little bit twisting like a pretzel, yes. And keep the breathing. Keep the length on the spine. And let it go. Last breathing. Untwist the neck. And untwist the spine. Move it up into your pelvic stance, into your tilting. Let the tension, let it go, okay? Again, left hand behind your back, right hand on your left knee. Twist from the belly. Take a deep breath and let it go. Keep breathing in. Keep doing the breathing. So the breathing is a nice way for you just to allow you to stay in the stretch and maintain the length of time that is needed for your body to release the tension. Look to your left shoulder, breathe in and breathe out. Breathe in again. Look to the opposite shoulder, breathe out. One more time. And breathe out. Last time, untwist the neck. And breathe out. Do your pelvic dance again. Release the tension. Alrighty, use your props at any time. It might be that the longer you're sitting in here, you have to come and out of them. So do it, all right? All right, second one we're gonna do, right hand's gonna go to the side and left hand's gonna come up and across. The hips is gonna stay planted to the ground and the elbow's gonna bend and you're gonna lengthen, okay? And relax your neck, let it just, no pain in any of the joints. Feeling the muscle tension is normal, but if the discomfort is too much, then you're not able to hold there for a minute or so, back off, do a little bit less, okay? Or do more if you want to make it a little bit more intense, because it doesn't feel darn good to do it, okay? Has to feel good. But why a minute? Why just that much time? Well, it takes about a minute for your body to let go the tension in the muscle. The muscle has what is called a creep phenomena, which means that about a minute or so, that creepy phenomena happens that the muscle is not able to hold the tension, you kind of let it go. So for the first minute, you're gonna feel like, oh my gosh, this is so tight. Take a deep breath, we're gonna go to the other side. And let it go. Release any tension anywhere. Hands to the side, reach over there. Keep the hips planted, okay? Take a deep breath and let it go. So the creep phenomena usually happens about a minute. Is the elastic properties of the muscle stop acting out and the muscle actually start lengthening, okay? Start fighting you and allowing new length to take place. Might be that you cannot do it to begin with when it started because you have too much pain. Do it less, do 30 seconds and build it up to add more flexibility, okay? So you're looking to get at least a minute if you have a lot of restrictions, so you can actually add new length. Otherwise, you're just decreasing the tension, but you're not necessarily adding new length. Take a deep breath and come back to the center and release the tension. All right. So the second one, we're gonna get a combination of your hamstrings and the inner thigh muscles, the adductor. So one leg is gonna stay bent, the other leg stays crossed. Oh, back off. Let's come back in here. We're gonna do that series one more time. As you notice, my preferred way to crossing is with my left leg forward. And you may find out yours is the opposite around. So you wanna actually cross on your unusual way because there is a little bit of changes on the restrictions between right and left. So you're gonna make sure that you alternating the crisscrossing right and left, and you are doing the movements one more time with that. So I'm gonna skip that because I wanna go over the other series of exercises, but that would be a good time for you to go back into when we started with these exercises with the twisting, right? And the side bending with the opposite leg crossed in the front, okay? Use your props as needed. I'm gonna move on to the adductor, and it again, props if you need it to be. I don't want a joint pain or feeling like you cannot be there for a minute. The props will perhaps allow you to be there for a minute and feel like, oh yeah, my muscles are finally relaxing. Similarly to the other positions, you don't want to be sitting on the back of your butt, hunched like this. So use your height. The height will allow you to sit tall and, oh yeah, more comfortable, okay? So try that, and then it's just gonna feel like so much better when you're using your props. But try with this. Now, if it's available to you, this hand that is close to the long leg is gonna go either to the floor or right below your knee, and the hips stay planted to the ground and your back is nice and tall. If you're not able to sit tall, you're not gonna move on to the next step. If you're here, your objective is to kind of start loosening up with that tilting and doing the pelvic dance side to side, circles to one direction and circles to the opposite direction until you're able to sit nice and tall. Look back at my mirror image. I'm not sitting in the back of my butt. I'm sitting nice and tall, like something is pulling me from the chest. Ready to move on to the next step of this stretch is hand to the side, and you're gonna reach up just like that side bending we did with the crisscross, but the hips is not hiking. My hips is staying here, and I'm lengthening here, and then I'm side bending in here, okay? So I'm not crunching like this, okay? I'm gonna curl right, nice and tall, and I'm side bending. So my spine is staying straight, not curving sideways. This is curving, this is straight, side bending here, okay? It's almost like a triangle pose, but we're not bearing on your legs, all right? Take a deep breath and let it go. If it feels good, you can look up. You're gonna feel a little stretching to the neck, lengthening into your spine. Hips are planted to the ground. gonna feel the stretch on the inner thigh here, and perhaps even on the Quadratus, Lumborum, and latissimus dorsi, which are muscles right on your lower back. Okay, take a deep breath. And let it go. Okay, come back in here. All right, now I'm gonna go to the other side. I use my prop because it feels very good in that way. Nice and tall. So if you feel like here's enough, you're gonna be here, and then you're just gonna hold the length. There's a couple of things you can do to help with lengthening and helping everything to glide and slide. The glide and slide that I'm referring to, that every part of our body has what we call fascia, which is almost like a very viscous surround gland. And everything's supposed to glide and slide on one another. So when you are lengthening the muscle, contracting on the muscles that are contracting are gliding and sliding over the muscles that are not doing any work. Okay, so they're kind of making that movement. So you can actually do a little bit of that windshield wipe motion into your leg, and then oh yeah, that feels more stretch. You can point your toes up and down, or like I said, doing the pelvic flex. Every time I do this, I feel a little tugging in there, and as long as it's not a pain, okay, it feels like more tense, it's totally fine. So this fascia that I'm describing is very important for people that have fibromyalgia, because that's the fascia that gets very, very inflamed. And then inflammation changes the property of that viscosity, and instead gliding and sliding one another, they are tugging, you know. Imagine that instead having a viscous, oily thing that slides, you have a grindy, sandy muscles on one another, and that creates more inflammation, and it keeps perpetuating the cycle. And stretching and exercising are pretty much the key for fibromyalgia maintenance, in addition to pharmacological intervention, which is not within the scope of my practice to go in that route. It's more on the exercise and stretching. So you have to kind of let it go a little bit of the tension and improve a little bit of that gliding and sliding, and you can achieve that with the stretches. Okay? Not only will help you to lengthen the muscle and improve the spacing between your joints, but it will also help you to restore a little bit of that gliding and sliding of the muscle. With the fibromyalgia, you're gonna do it gently, but you're gonna do it often. And like I said, take the showers, take the magnesium pills or magnesium bath salt, with Epsom salt bath. Those things will help you to improve a little bit that viscosity and help everything to be a little bit easier to glide and slide. So use your tools wisely to allow you to stretch the muscles. Okay, so let's go into that side bending here. If you didn't do it, you're gonna be there for another minute. Hopefully you already did it. For those that took the step forward, but those that did not need it, we're gonna move on to the next one. Alrighty. Okay. My next favorite one is not everybody can do it, but it can really help with hip pain, because people have a lot of restrictions in the joints for internal and external rotation. I will highly recommend use the props for elevation. So I call the Mermaid Post. Okay. And then if you have any hip replacement precautions, this is something you're not going to be doing. Okay, so you're going to skip this part and do everything else but the internal rotation. But for anybody that does not have any hip precaution, this is something you can do it using your props. I don't need my props. You know, I can easily sit. We're looking for both of the hips to be sitting. Not a lot of people have that much flexibility, so they're going to be with the hip over here. And then little by little, it will kind of set and be squared again. But right now, this is where the muscles are going to be restricted. This position, as long as you don't have any hip pain, alrighty, and you can just sit in here, use the props if it's needed, okay? And you can do the knee like this as well. Usually this should be okay. It's more like, it will be like this, little by little, and you can put the prop on the butt that is too elevated. And you can just little by little let it go, start doing the pelvic dance, trying to work it out, the restrictions of the hip. And it's like, if that feels okay, remove the props, and you just started with just sitting in here. It's a good position to massage some of that pain. This is a very common area on IT band that people have pain. This is a good position to do some of the massages in there as well as on the calf muscles. Start with that, and after a minute, you're gonna move on to the other side. So this is the one that I have a little bit of restriction in my left, so I'm gonna put my prop on my butt cheek, and I feel like a lot more comfortable. And you can use the props as well to use your hands to help you to be tall and kind of grind it, plant that hip bone into the floor. And usually on the handouts, people might be doing a little bit of that lengthening. We talked about it to get the stretch going in here, as long as there's no pain into that hip that is internally rotating here. Take a deep breath in here. And go. It might be that the side bending is one thing you can do. The other thing you can do the twisting, similar that we did it with the crisscross. Okay? Take a deep breath and let it go. We're not holding the twisting as long as we did on the first time, because we are just looking to get comfortable and used to be in this mermaid position for the hips. Alrighty. Okay, so another one that is my favorite one, it is for the Quadratus lumborum muscle. That one is usually people feel a lot of pain into the flank here of the spine. Okay, so we start as sideways, bottom leg straight, and you're gonna try to get the hip, shoulder, hip, knee, and leg getting straight in here. I'm able to go straight into that side vein in here, but some people might start it into the elbow. Okay, if the hip bone here is too tender and you're not on your bed, using your prop is another way. So if this leg falls, when you have a lot of restriction here, your knee may be like all the way up here, but little by little, that will start kind of falling forward, twisting a little bit in the lower spine. And same thing with this hand down here. This can help to support, and you lift it up, and gradually you're gonna bring it here. It will not be available to you on the first attempt. It might be with repetition that you're able to gradually bring you into more of this goddess position. And that's what I usually tell my patients, feeling the grace, right? So, but this is like a nice lengthening in here. And you just breathe. If you kind of pull your muscles into this area, you're gonna see that it's very tight, it's pulling quite a lot in there. And you're gonna just do those 5 to 6 long breathing in there, which is about a minute, right? And just letting the tension decrease. Feeling that the tension decreases the longer you are there. If you feel like you're holding the tension, the longer you're there, you're pushing yourself too hard. It's supposed to feel good, not worse, okay? And let it go. Now we are gonna go to the other side. So again, using your props, make sure that your bony areas are not hurting. And oh, there you go. Now you can see a little bit better in there. Good. Lengthening, straight line, head, shoulders, knee and toes, right? Lengthening here and feeling this tightness decrease. Taking a deep breath in and out. Letting the tension go away. The longer you stay in there, breathe in and out. And if it's available to you, because you're not feeling a lot of stretch, you can do a little twisting. But like I said, not available the first time you try. All right, now we're gonna let it go. You've been there for about a minute. Go back in that initial position in your sitting crisscross. And you may find out, oh yes, I have more movement. Everything feels so much more relaxed. So try to Those are my basic ones. So the to-go ones for hip pain, okay, and back pain and hamstring pain. Start with them. Do every day. It might be that you have to do more than once a day, and like I mentioned to you, using some heat prior to your stretches. And if you want to stay nice and flexible, having a lot of more movement, you can do another heat pack after your stretches. If you feel like, oh yes, I have a little bit more achiness, maybe do a cold pack. Totally fine with that. But remember, cold brings stiffness. It will help with the pain, but it will make you feel stiffer on the joints. But your body may respond better to cold than to heat, and everybody's different, and it changes from day to day. I myself have gone back and forth between cold and heat, trying to find out which one's gonna help me with my pain for whatever I did it, and it has changed. So I love heat. I'll do heat any day at a time, anytime. But sometimes my body just needs that cold, okay? Also electrical stim, right? If you know how to use it. If you don't, look for the video on the prop of how to use the electrical stim units. Hopefully that will guide you, but there will be a whole video on pain management and how things you can do to help your pain management. Stretches is one of them. Heat and cold, electrical stim. So we're gonna go over that in a different video. Hopefully you found these stretches useful. Do them regularly and frequently, as much as needed, until your flexibility has improved. Anytime you have pain, that's definitely the time for you to do it, because if you feel good afterwards, you know that your body's gonna respond each time by doing more and more and allowing that flexibility to take place. Alrighty, don't forget to subscribe. Hit the subscribe button right now and share with your friends the links, so more people can benefit from understanding how to do the stretches and how to decrease their pain, their stiffness, and manage their physical health. All right, have a great day.